Hello everybody, welcome to my channel. It's Carol Kate here again, and today we are going to talk about my experience as a nurse for my first year. Being a nurse is a very tough job. It's not all that glamorous, and it can be really hard, especially on your first year. And it depends where you work as well and how well you adjust to the place. Now, it is very different from when you are a nursing student, because on the first year, when you are on your own, you get to experience new cases and situations alone. And, of course you have your charge nurse and coworkers to depend on, but obviously you are learning everything on your own, and you're finally standing on your own feet instead of being a student nurse. Well, this is for everybody out there who might be doubting themselves or have fear or scared to go to work, okay? So let me talk about this first. I graduated in May 2015, and I took the NCLEX right away a month after, and I passed right away in 75 questions. And then I traveled for a while, and I was supposed to start working in December or January, but I pushed it off to February because I know that it will be a long-term commitment. So I started working in February 2016 in a neurotelemetry unit, but honestly it's not just neurotelemetry. We're also a certified stroke unit, but rather we're also a cardiac telemetry unit and an observation unit. What does this mean? It means that it is a pretty hard floor to work in, and even if you ask travelers and some people who get floated to our floor, because we're always short staffed and it's a hard floor, they will always tell me that our floor is pretty tough. And if they tell me all the time that if you get to work on this floor, you'll be able to work in all types of other floors. So we take medical surgical patients, we take telemetry patients, and ICU step-down patients, and some of them too are basically, they're about to be ICU patients, but they're just not unstable enough to be in the ICU. Now that depends on the protocols and procedures of your unit on what they can do and what cannot do, but it's basically an ICU step-down telemetry unit. So that said, it's a very fast-paced floor, and I had some tough time, and I think that's all of us new nurses. What's gonna happen is that we're gonna have a tough time at first, and then later on we're gonna excel in what we do. So this video is going to be about the before and after, and I know some of you might be about to go to nursing job, about to go to nursing school, or about to be 6 months or 1 year. Now I've been working for over a year now, and I'd say that I'm pretty comfortable at what I do, but back then I used to be anxious and scared, and that's okay and that's natural. That really depends on the person. Okay, so are the before and afters. So before, and I made a list. So before, I was scared to go to work for the first 6 months. So before I would go to work back then, I'd be so anxious and scared because I've had some scary experiences. I mean, I've made it through them and I've saved people's lives, but I was really, really scared to go to work. And even sometimes now, I feel anxious, especially when I go back to the same patients and I know some of them are pretty unstable. I still get anxious to go see them because something unstable might happen again tonight, and it's just gonna be a long night. So, but otherwise I'm pretty confident and comfortable in my job now. I'm used to the adrenaline rush, I'm used to the busyness and craziness that happens with it, but there are definitely some good peaceful nights as well, and I definitely cherish that. So fear is normal, anxiety is normal, and at the end of the day you're just gonna be proud of yourself that you made it out through those nights, and you get to go back home to your family, to your dog, and be yourself again. Okay, so back then, since we're a telemetry floor, I would sit nearby the telemetry monitors all the time. Like, since I have some patients with heart problems and they're on telemetry with the heart monitor stickers on them. Okay, well, I used to sit by the telemetry monitors outside their rooms like a paranoid person. So that was for the first, I'd say, like 6-8 months that I'd usually sit. No, probably 3-6 months I'd sit by the telemetry monitors. Now I still look at it frequently, but I don't think of it as much anymore unless I'm really concerned about a certain patient's heart rhythm. So I only look at it frequently here and there, but I don't sit by the telemetry monitors anymore. Before, I would freak out with chest tubes or NG tubes or those CBI so that they don't get clots through their urine and whatnot. Well, now I'm pretty comfortable with them. I still get scared when it's a patient that's kind of out of it. You just have to be careful. You keep reminding the patients not to pull out those tubes, or when they go to the bathroom and whatnot. You just have to orient them frequently, because people that are sick are not super alert and oriented when they're in the hospital, because they have all these imbalances going through their body. So now, after, I'm pretty comfortable with it, but you just have to still be careful. Before, I was really OCD with the bed alarms, because again, patients are not really with it, and you don't want to have falls. When you have a fall, you have to write an incident report, and you have to have a little huddle with your manager and whatnot on what you could have done to make it better. So now, after, I'm still OCD with bed alarms, especially working in a neuro unit where people have stroke or people have some neuro or body movement deficits. You really want to be careful with that. So, of course, as a first year nurse, you got to think about this, because some of your patients might be on a heparin drip, and heparin's a blood thinner, and your patient's going to have, if they fall, or they're going to bruise easily, or if they fall on their head, you're going to have to do a CAT scan of the head, make sure there's no intracranial bleeding. So, of course, this is my tip for those new nurses out there. You have to be careful, and safety is still number one and what to worry about. Back then, before, I used to be scared of drips, such as heparin drips, cardiac drips. So in our floor we use cardiac drips, and this can be amiodarone or cardizem, and these drips are basically for patients with irregular heart rhythms such as AFib, or their heart's beating too fast and whatnot. So these drips are really important, and some hospitals, telemetry floors are only able to titrate it down. But us in our unit, in our hospital, we are able to titrate it up and down. So that's part of our scope and part of our responsibility. And that's a lot, because if you titrate drips too high or too much, that can lower somebody's blood pressure really fast. So you have to be careful on what to check for. You have to frequently check their blood pressure, and these types of drips like heparin and amiodarone, these are tuner's verification. So every time you adjust it up or down, you have to verify with another nurse and make sure that they're doing it correctly and that their vital signs are stable and appropriate. So now, after I've learned more with these drips, I'm pretty comfortable with them. When you're the first one to start them, obviously you have to be really careful and monitor the patient extra frequently, because again, I've had experiences where, let's say they're like AFib and their RVR, heart rate's like 150s to 160s, but then their blood pressure starts tanking down along with their heart rate. We want their heart rate to go down and be controlled AFib, but then their blood pressure is tanking down as well because it's a normal side effect. Well, then that's going to be a long night, because you're going to have to bolus them with fluids so the BP gets up higher if appropriate, and if not, you're going to have to start them on a vasopressor or another type of drip. So we don't want that, okay? So just be careful with them, guys, and make sure that you always do 2 nurse verification. Back then, so let's talk about a little bit of delegation, and this is kind of like NCLEX stuff. So I've had experience with CNA, and I also went through like an LPN school back then. Well, being a new nurse and being a new grad, when I started working on the floor, it was kind of tough on how to make commands, and how to make commands, meaning like, you know, how to be like kind of assertive on what you need from other people. For example, like the aides. Some aides, I'm really good with them now, but in the beginning it was tough because you know, they've been there for so long and they know I'm a new grad, and maybe sometimes they felt like they could not take advantage of me, but like, you know, that I was new to the floor, so they kind of like, we didn't know each other's dynamics yet. So it was really tough to know everybody's personality and how to communicate with them and how to ask something from them or how to command them. But honestly, this is something that you're gonna have to do in your first year, is assess how people are around you, how you're gonna communicate with them, what they're sensitive about, and also on how you can ask for help from them and how to react to them as well. So now I figured that out, and I'm pretty comfortable with everybody, and it works. We have to collaborate. You have to collaborate with your team so that you're safe, they're safe, and your patient's safe, and that the outcome is just better overall. So back then I was scared to call doctors. You know, either it was for something little as a new PRN medication or something for an emergency. I was scared to talk to doctors. I used to practice how to talk to them maybe my first 2 months when I was with my preceptor and when I was alone my first 2 months. But then after that I got comfortable, and now I don't really even have to think of what to tell the doctor before I call them. I just call them and then wait for them to call me back. Unless there's some like complicated situation, then I still kind of think of what to call a doctor, how to call the doctor and what to suggest, because there are some complicated situations out there. But pretty much I am comfortable with talking to them and asking for what I need and how to explain things, and that just comes over time, and that takes some experience. Back then I felt that my floor is too busy, and even there's days where I still feel like it's still too busy right now. I'm imagining having 4 patients, one's on a cardiac drip, one's a confused patient trying to get out of bed. That's, you know, for example, one patient is SOB exacerbation, one patient is something really, really complicated, like maybe sepsis and whatever, declining, whatever. So it's a lot to take in, and imagine sometimes companies will try to like put you in a 5 patients to 1 nurse ratio, and that's not even probably really bad to what you guys think, but it can get really, really bad. I like to stay at a maximum of 4 patients. So in our floor, because it's a really tough floor, people try to quit right away and go somewhere else, and I thought that's how it was for me too. Like I said, maybe I'm gonna just do this job for a year, even though I like the people and I like what I do. Maybe I'm gonna transfer after a year, after I reach my 1 year of experience. But you know what? Now, after, I'm pretty comfortable with what I do and the people that I work with and my unit. I just can't imagine leaving my team behind. Although I still do have a lot of goals and experiences that I want to try out, so I'm just careful about what I want to do next, because I do love my floor. Even though I'm comfortable and confident, I feel like I still have more room to grow in my floor, and also I do want to go to another unit and grow as well. So that's the thing about your first year of nursing. Either it's like you really, really love your job, or you really, really hate it. And after that, that's okay. You can always go somewhere else if you're not really into what you're doing. So there's only days when I didn't like what I was doing in my first year, but now, I mean, I'm into it and I like it. So back then, I'd be really scared of rapid responses and code blues, and I still am today. That's normal. I've probably had a few rapid responses or my patients before, you know, just because of big, sudden, or rapid situation has changed on my patient, and you know, and it's still a blur even until now. It's a blur. You're like, you know, because all the respiratory therapists come, all the house supervisor comes, charge nurses, CNAs comes in the room, and they're there to help you. So I do feel more equipped and experienced in that way, but at the same time it's still a blur, it's still nerve-wracking, and that's totally normal. But I'd say that I'm pretty more comfortable with it now compared to back then. Back then I used to be so nervous to give report to the next nurse. So I'm a night nurse and I take care of my patients from 7 p.m. to 7 a.m. in the morning, and I give report to nurses about 7:15 a.m. And back then I used to be so scared because some nurses are rough out there. They will ask you, you know, what the patient's diet is, how they get up and whatever. And those are things that you should know, and and whatnot. But you know, there's things that they would ask about, you know, the background of the patient and what the plan is. You know, as your first year, it was kind of hard to put together because you're just kind of into the basic, and your common sense is still kind of like developing. I mean, yes, you have common sense, but I mean like to try to put things together and why something happened and what's about to happen. That's kind of tough at first, but now after that I've had a lot of experiences, and I get to think through things a little bit more in a different level. You know, you get to understand the more complicated situations, and that's okay. In your first year you'll just be pretty simple and do know the basic stuff to survive. But when after a year, I'd say that you are able to put the puzzles and pieces together and maybe even predict things. Like you're going to predict what the next step will be and what the next procedures will be, or what the doctors might even want, because you already kind of know the doctors and you already kind of have seen a similar situation before. So you'll understand what I'm talking about once you get there. And back then, I used to be scared on like IV infiltrations, you know, because some old people have some really hard, some really like sensitive skin and thin skin, and some IV fluids that might be running through their skin or antibiotics can really damage their skin really badly. And I've seen this, not really badly, it was just something that maybe like the skin kind of bubbles up because the vein blew or something. So I've seen this a few times, but it wasn't anything harmful or bad. I stopped it right away. But yeah, there was a time where I was really scared of all IVs running in patients' arms. You know, they can be maybe phlebitis or infiltration or something like that. So you know, that's just something to look out for as a first year of nurse. But now I am pretty calm about it, and you just check their site, make sure that you, in the beginning of your assessment, in the beginning of the shift, you check their arms, the IVs that's running through them. Make sure that you check those out, because you don't know if that's going to be from you or maybe the previous nurse before you that did the damage. And we never know. People's veins and skin is just so unpredictable. And also make sure that their IVs work, so that in case of emergencies that you do have an IV in case of a code or rapid response, or if their blood sugar is low out of nowhere. Make sure they have a nice working IV in their body. And when you start IVs, it's either hit or miss. Before I was scared, and now I'm still kind of scared because I just don't like hurting people and poking them. But I know there are other nurses out there who loves to like poke others and enjoy the opportunity to be able to start IVs because they love being able to accomplish and start a new IV. For me, it's a hit or miss, and that's okay. But everybody has strengths and weaknesses, right? So you just gotta practice on things that you think you're good at and what you're not good at. Overall, you just gotta take it one step at a time. On your first year, don't be scared to ask questions and, you know, ask the right person, ask the right people. And also, there's never a wrong question to ask. I mean, but don't ask them questions though, okay? But if you're not sure about something, ask somebody. If you're not comfortable with doing something, ask somebody. But do make sure that you are progressing, and if you're not progressing, you know, ask for extra help and other things, opportunities that may help you, because this is important as a nurse. Every day we learn something, and these skills, knowledge, and just this empowerment in yourself as a nurse is very, very important. That growth is very, very important. So don't be scared, have confidence in yourself, turn that fear into power, turn that fear into strength, and you guys got this. Good luck, everybody. Mwah.